Abhijit, can you confirm that you can hear me clearly? Yes, ma'am. Thank you. Good afternoon, everybody, and good morning, good evening to those joining us from elsewhere. I'm Anupama Srinivasan, and on behalf of REACH and USAID India, thank you so much for joining us today for what promises to be a very unique and exciting conversation. I think March is always a very busy month for those of us in the TB world, between Women's Day on March 8th, World TB Day on 24th, and of course, culminating in World Health Day on the 7th of April. Today's webinar, Women Ending TB, is our way of celebrating women leaders and their contributions to our collective efforts to end TB in India and around the world. Before we begin, a few housekeeping announcements. Please note that we are recording this webinar. We're also live streaming it on Facebook. I know some TB champions were requesting that they could watch it on Facebook instead. Finally, we don't have a formal Q&A session, but we do invite everyone to please use the chat box to share your thoughts, your comments, and of course, to answer any questions you have to our panelists, and we'll do our best to respond to all of them in the chat box itself. On that note, I now invite Dr. Ramya Ananthakrishnan, Director of REACH, to kick off today's webinar. Dr. Ramya, over to you.
Thank you. Can you hear me? At the outset, I would like to extend a very warm welcome to all of you present here for this webinar, Women Ending TB. My special thanks to our esteemed panel members for truly inspiring women championing important issues related to TB and the broader public health. They are the women leaders shaping India's response to end TB from behind the scenes and at the center of public and private healthcare delivery, research, media, community systems, and they are driving policy and societal changes. A very special welcome to Sangeeta, Amy Piatek, Dr. Ruben, Amrita, and the entire leadership team from USAID for their gracious presence. Through the USAID support, we have been able to work very closely with affected communities and educate, empower, and engage them in a truly transformative journey for the TB survivors to the TB champions. This webinar is being conducted with USAID support through the Allies project. I would also like to extend a very warm welcome to all the participants who have joined us for this exciting webinar. Especially, I'd like to extend a very warm welcome to all the TB champions who have registered and joined us. मैं आप सभी इस वेबिनार के स्वागत करती हूँ। जैसे कि हम अंतर्राष्ट्रीय महिला दिवस के पास है, मुझे खुशी है कि आप सब TB चैंपियंस, खासकर महिला TB चैंपियंस यहाँ पर है हमारे साथ. A very warm welcome to all of you. I'd also like to inform you and welcome Dr. Soumya, who has actually sent her video message. She is a very good friend and a well-wisher of REACH, and I think she is a truly inspiring role model for many of us, especially in the field of public health. She wanted to join us for this webinar, but because of her prior commitments, she was not able to join us. I'd really like to thank Dr. Soumya for giving us this truly inspiring video message. REACH as an organization's commitment to empowering women and girls have been entrenched in the organization's ethos. So though we didn't start with the core goal of empowering women, this has become very, very important to REACH. Since inception in 1998, when our founder director, Dr. Nalini Krishnan, began this organization with 2 women as our first employees, REACH has been a women majority organization at every level. They have been the forefront of service delivery, strategy development, and decision making. Today, we have more than 55% of the team comprising of women, and they are helping in supporting people with TB across the country. So I think this particular webinar is something very close to our heart as an organization and to all of us. And we are very excited to see the exciting group of panel members, and we look forward to a very informative, rich panel discussion. Thank you very much. And once again, a very warm welcome to all of you.
Thank you, Dr. Ramya. For all of us at REACH, as Dr. Ramya mentioned, it's been a privilege to be working closely with and supported by USAID India for over 6 years now. I'd now like to invite Amrita Goswami, Project Management Specialist at USAID, to offer opening remarks. Amrita, over to you.
Thanks, Anupama, and thanks, Dr. Ramya. Hello, everyone. For those who don't know me, my name is Amrita, and I work as part of the TB team at the Health Office at USAID India. I think on behalf of USAID, firstly, I would like to thank REACH for all the support for really organizing this webinar today. The Central TB Division, without your continued support, none of our activities would be successful. All our panel members who've joined us today, and like Dr. Ramya said, and all women in panel, and really looking forward to hearing from everybody. And of course, all the participants for joining us for really, I'm sure, very interesting and important conversations around women ending TB. We've been talking a lot about gender differences and inequalities, which have been playing a significant role in how people of all genders, not just women, how they access and receive healthcare services in the public and the private sectors. And especially women are constrained by a number of social norms that really prevent them from prioritizing their own health, overall well-being over their families. And they often do not have the same access to healthcare and treatment as other counterparts, like the main counterparts. And, I really don't need to say that, but in the case of TB, which is, really despite the pandemic, the current pandemic remains one of our country's, one of India's pressing health challenges. And there is adequate evidence to really indicate that gender is a significant influencer, not just in the epidemiology, but also the risk factors, the probability of diagnosis, again, access to healthcare, treatment adherence, and really the overall impact of the disease on communities at large. And like I said, today's webinar will be an opportunity for all of us to hear from our wonderful women panel leaders, who've been at the front line of the response to TB. And each of them in their own capacities, whether as technical experts, as really powerful TB advocates, as members of civil society, or as TB champions supporting people with TBs, or even program implementers, all of them have really played a very important role in our collective efforts to end TB. I really look forward to hearing from each speaker about not just their own personal journeys, but also about the opportunities that they've had, the challenges they've faced, especially as women working in public health. And really all of you today are role models, especially for young women and girls who are aspiring to work in the public health to support their communities. For example, especially you'll very soon listen to the TB champion sharing her experience. And this will really testify how, as women, they are drawing upon their own personal experiences of TB to really support their community, especially women, and help them cope with TB. And this is really an illustration of the ripple effect of empowerment, how empowering one woman can be, and how that really empowers the community as whole. And we've been working with REACH since 2016, and like what Dr. Ramya said, this really empowerment-led approach is at the heart of all our efforts and the work that REACH is doing through the USAID-supported project. Initially, the TB Call to Action project, and currently with the Allies project. And really, we are looking at a whole community accountability framework to improve the quality of care and services. So all our trained TB champions who are working working with the health system, with people detected with TB and the communities. They really strive to find local solutions, and all the women are a very, very critical part of it. And empowerment can be a huge game changer at every point in the cascade, in the care cascade, actually. So we are empowering the women with information, with knowledge, with the skills that they need to become active leaders in the community. And we saw this during just the last 2 years of the pandemic itself, you know, how they are at the forefront of a community movement to end TB, and really to advocate for the highest level of healthcare for all. And I'm sure something like this is also, you know, our panelists today also will be reflecting on this aspect. And over the last few years, a number of USAID's partners like REACH have been working closely with CTD, with the NTEP, to really strengthen the TB affected communities and establish a gendered approach to TB. As a result of these efforts, actually, India became the first high burden TB country to have a national framework for a gender responsive approach to TB. And in fact, this year, the World TB Day will mark a year since its launch. And really, we've all been striving to ensure that all TB services, whether for men, women, or the transgender community, take gender-specific needs into account. And obviously at USAID, we are committed to continuing to work closely with all our partners, including the NTEP, to really accelerate our efforts for a TB-free India. I think with this, I welcome everybody once again. Thank you for taking the time to join us today. Thank you, REACH, for all the support and the collaboration, and to CTD as well. And I look forward to the discussions. Thank you.
Thank you so much, Amrita, for all your support and for constantly pushing us to do more. We really, really appreciate it. Thank you. For the last 2 years, REACH has had the opportunity to work with a very special group of women from 4 districts of Tamil Nadu, our women TB leaders. Today, we're humbled to be screening for the first time a short film. And to briefly tell you more about the film, I invite Dr. Ramya. Dr. Ramya, over to you.
Thank you. As part of the Stop TB Partnerships Wave 7 grant, we undertook the project Mentors for Community Health to empower women in the community on TB care and prevention activities in the state of Tamil Nadu. Over 200 women TB leaders and close to 1,000 community health mentors were trained during this initiative. And what was very heartening to see was that working in TB care and prevention actually provided the springboard for many women in the affected communities to become empowered, not only professionally, but also personally. For many of them joining this initiative, it marked their first employment and a departure from their primary role as homemakers. As a result, they were able to take their first steps towards financial independence, and they have actually become the main earners in their families. In turn, this has helped them to feel secure and also enabled them to get their children well educated. So we are very proud on behalf of REACH to present to you for the very first time, Sadikava Penne, Come On Women, Let's Achieve Together, featuring 6 women TB leaders in the state of Tamil Nadu who have undergone this transformative response while working for TB.
தேவி, என்னோட பேர் பரமேஸ்வரி, என்னோட பேர் வந்து சுகுணா,
என் பேர் காந்திமதி,
என் பேர் ராதிகா,
என் பேர் ஜெயந்தி, நான் வந்து விழுப்புரம் டிஸ்ட்ரிக்ட் தியாகதுர்கம் பிளாக் பிஹெச்ல உமன்ஸ் டிபி லீடரா ஒர்க் பண்றேன்.
சின்னசேலம் ஜிஹெச்ல நான் வந்து காசநோய் மகளிர் தடுப்பு தலைவியா வேலை பார்க்குறேன். காசநோய் பிரிவில் தான் வேலை பார்க்குறேன்.
டிபி டிபார்ட்மெண்ட் தெரியுமாமா அப்படின்னு சொன்னாரு. நீங்க சொன்னீங்கன்னா தெரிஞ்சுக்கிறேன் சார் அப்படின்னு சொன்னேன்.
நான் களை வெட்டிட்டு இருந்தேன். அப்பதான் மேம் எனக்கு ஃபோன் பண்ணாங்க. எங்க டிஸ்ட்ரிக்ட் மேம் எனக்கு ஃபோன் பண்ணாங்க. காந்திமதி நீங்க வந்து காசநோய் தடுப்பு தலைவி, அதாவது கிராமங்கள்ல போய் விழிப்புணர்வு கூட்டம் நடத்தணும், நீங்க வந்து நடத்துறீங்களா அப்படின்னு கேட்டிருந்தாங்க.
அப்போ நானும் சரின்னு சொல்லி ஒத்துக்கிட்டேன். இந்த வேலை எப்படின்னா உமன் டிபி லீடர்னு சொல்லி சொன்னாங்க. ஹாஸ்பிட்டலுக்கு வந்து நிறைய நோயாளிங்க வருவாங்க. டிபி சிம்டம்ஸோடய நிறைய பேஷண்ட் வருவாங்க. அவங்களுக்கு வந்து டாக்டர்ஸ் எல்லாருமே வந்து டெஸ்டிங்லாம் எழுதி கொடுப்பாங்க. ஆனால் அவங்க டெஸ்டிங் சில பேர் போகிறது கிடையாது. அந்த மாதிரி பேஷண்ட்கள் வந்து மிஸ் ஆகக்கூடாது அப்படிங்கிறதுக்காக தான் இந்த மாதிரி ஒரு போஸ்டிங் இது பண்ணியிருக்காங்கங்கிறத நான் தெரிஞ்சுக்கிட்டேன்.
ஓபியில் போய் வர பேஷண்ட்டுக்கிட்ட எல்லாத்துக்கிட்டையுமே வந்து ஃபஸ்ட்டு சாப்பிட்டீங்களான்னு தான் அவங்க கேட்பேன். ஏன்னா வந்து ரொம்ப வெளியூர்ல இருந்தெல்லாம் வருவாங்க. அவங்கள்ட்ட நம்ம இதை கேட்டாலே வந்து அவங்களுக்கு கொஞ்சம் சந்தோஷமா இருக்கும். சாப்பிட்டீங்களான்னு கேட்பேன்.
ஃபீல்டு ஒர்க் நான் போகையில என்னைய பார்த்தாலே எல்லாரும் ஓடி ஒளிவாங்க.
அந்த டிபி வந்தவங்களுக்கு உடனே கால் பண்ணுவோம், ஐயா கொஞ்சம் உங்களுக்கு சளியில தொந்தரவு இருக்கான், நீங்க வந்து என்ன பாருங்க.
இந்த மாதிரி இருமல் இருக்கா, சளி இருக்கா, பசியின்மை இருக்கா, காய்ச்சல் இருக்கா, வெயிட் லாஸ் இருக்கா, எது இருந்தாலும் நீங்க என்கிட்ட பேசலைனாலும் பரவாயில்ல, பர்சனலா எனக்கு ஃபோன் கூட பண்ணலாம் அப்படின்னு சொல்லி அந்த கிராமம் ஃபுல்லா நான் என் மொபைல் நம்பரை எழுதி வச்சிருப்பேன். மகளிர் தலைவி அப்படி, காசநோய் மகளிர் தலைவி அப்படின்னு சொல்லி என் மொபைல் நம்பரை எழுதி ஒட்டி ஒட்டி வச்சிருப்பேன்.
ஓபியில இருந்து ஸ்க்ரீன் பண்ணணும். ஸ்க்ரீன் பண்ணி டிபிக்குள்ள சிம்டம்ஸ் இருந்துச்சுன்னா அந்த பேஷண்ட்டை வந்து டாக்டர்கிட்ட கூட்டிட்டு போகணும். கூட்டிட்டு போய் அவங்களுக்கு வந்து டெஸ்டிங் எடுக்கிறதுக்கும் நான் வந்து ஹெல்ப் பண்ணியிருக்கேன்.
அப்புறம் மொபைல்லாம் யூஸ் பண்ண தெரியாது எனக்கு. மொபைலே யூஸ் பண்ண தெரியாது. பட்டன் செல்லு தான் வச்சிருப்பேன்.
சின்ன ஃபோன் யூஸ் பண்ணிட்டு இருந்தாம பெரிய ஃபோன் கையில் வச்சிருக்கோம். இதில் என்ன பண்ணணும்னு தெரியாதே. எங்களுக்கு ட்ரைனிங் கொடுப்பாங்க இல்லையா, அப்போ எழுதி வச்சிருந்தேன். அதெல்லாம் என் பையன்ட்ட சொன்னேன், தம்பி இதெல்லாம் பண்ணணுமாண்டா, இந்த மாதிரி பண்ணால் அதெல்லாம் ஆஃபீஸ்க்கு ரிப்போர்ட் ஆன்லைனில் அனுப்பணுமாண்டான்னு சொல்லியிருந்தேன். என் சின்ன பையன் 1 மாதம் எனக்கு ரிப்போர்ட்லாம் அடிச்சு கொடுத்துட்டு இருந்தோம். 1 மாதம் கழிச்சு எங்கள் வீட்டுக்காரர் சொன்னார், உன் வேலையை பையனுக்கு வைக்கக்கூடாது, வச்சின்னா உன் வேலையை நீ எப்படி கற்றுப்ப, உன் வேலையை நீ தான் செய்யணும் அப்படின்னு சொன்னார்.
நடுவில் வந்து என்னோட வீட்டுக்காரர் இறந்துட்டாரு. அவர் இறந்ததுக்கப்புறம் வந்து என்னோட லைஃபே வந்து ரொம்ப திரும்பி வந்து தலைக்கீழ ஆயிடுச்சு. ரொம்ப கஷ்டப்பட்டுட்டேன் நான். இவ்வளோதான் அப்படின்னுட்டுலாம் இல்லை, ரொம்பவுமே ரொம்ப ரொம்ப கஷ்டப்பட்டுட்டேன்.
நான் வந்து டிபி பேஷண்ட்டாக தான் ஃபர்ஸ்ட்ல இருந்தேன். என் பொண்டாட்டிக்கு ஏதோ ஒரு நோய் வந்துருச்சு, இனிமேல் நான் அவ கூட வாழ மாட்டேன் அப்படி சொல்லி கோர்ட்டில் கேஸ் போட்டாரு. கேஸ் போட்டு கோர்ட்டு கேஸ் போயிட்டு இருக்கு. அப்போ வந்து அம்மா தான் எனக்கு முழுக்க முழுக்க ஃபுல் பொறுப்புமே அம்மா தான் பார்த்துக்குவேன்.
ஒரு நேரம் வந்து அப்பா எங்கம்மா அப்படின்னு கேட்பான். எனக்கு சொல்ல தெரியல.
கரெக்டாக 10 மணிக்கு அந்த டேப்லெட் போடுவேன். 10:15 மேலே எனக்கு என்ன நடக்குதுன்னு தெரியாது. என் பையனை கூட என்னால் பொழிச்சு பார்க்க முடியாது, அந்த அளவுக்கு நான் கஷ்டப்பட்டேன்.
அதாவது கடவுள் வந்து எல்லாத்துக்குமே இந்த மாதிரி ஒரு இதை கொடுக்க மாட்டாங்க. உன்னால முடியும் அப்படின்ற ஒரு மனப்பக்கம் இருக்கவங்களுக்கு தான் இந்த மாதிரி ஒரு இதை கொடுப்பாங்க. இதை தாண்டி நீ வெளியே வா தேவி அப்படின்னு சொல்லிட்டு அவங்க சொல்லுவாங்க.
அவங்க சில சமயம் இவ்வளவு கூட்டத்துல போய் நீ வேலையெல்லாம் பார்க்க வேண்டாம், பேசாம வீட்டுல இரு அப்படிங்கிற மாதிரிலாம் சொல்லுவாங்க. இப்போ நம்ம பொய்கை பிஹெச்ல வந்து பஸ்ஸே கிடையாது. லோட ஆட்டோலலாம் ஏறி போயிருக்கேன். முதல்லலாம் அதெல்லாம் ரொம்ப பயப்படுவேன். இப்படி போகலாமா, ஒரு ஆம்பளையால் கூட தனியா போகலாமா அப்படிங்கிற மாதிரிலாம் பயப்படுவேன். அந்த பயம்லாம் என்னை விட்டு போயிடுச்சு.
இதுக்கு முன்னாடி நான் எப்படி இருந்தேன்னா,
பேசலாம் எனக்கு வராது. எப்படி பேச, நம்ம பேசிடுவோமா அப்படிங்கிற மாதிரி இருக்கும்.
வீட்டுல இருந்து அப்பா தான் கூட்டு வருவாரு, அப்பா தான் கூட்டு போவாரு.
சாதாரண கடைக்கோ இல்லை எங்குமே நான் போனது கிடையாது, ஒண்ணுமே தெரியாது.
இப்போ இவ்வளோ கூட்டத்தில் நம்ம எப்படி பேசணும்னு சொல்லி நான் ரொம்பவே பயந்துட்டே இருந்தேன். லாஸ்ட் 5 நிமிஷத்துக்கு முன்னாடி கூட நான் என்னால் முடியாது, நான் கிவ் அப் பண்ணிக்கிட்டேன், வேற யாரையாவது பேச சொல்லுங்க மேம், எனக்கு ரொம்ப பயமாக இருக்குது அப்படின்னு சொல்லி சொன்னேன். ஆனால் வந்து மேம் எல்லாருமே வந்து இல்லை உங்களால் முடியும், நீங்கள் பேசுங்க, நாங்கள் சப்போர்ட் பண்ணுதோம்.
நான் போய் கண்ணாடி முன்னாடி நின்று நீ நாளைக்கு போற, நீ போய் நீ இதை தான் நீ பேசணும், டாக்டர்கிட்ட போய் இப்படி பேசணும், பேஷண்ட்கிட்ட இப்படி பேசணும், டெஸ்ட் எடுக்கிறது பேசணும், போல்டா பேசணும், பேசும்போது அவங்க கண்ணை பார்த்து பேசு அப்படின்றத நானே பேசி நானே கத்துக்கிட்டேன்.
முதல்ல ஒரு 10 பேஷண்ட் கிட்ட பேசுவேன். 10, 20 ஆச்சு, 20, 30 ஆச்சு. 12 மணிக்குள்ள கிட்டத்தட்ட ஒரு 500 பேஷண்ட் கவர் ஆயிடுவாங்க.
ஆனா இந்த வேலைக்கு வந்து எந்த பிரச்சனைனாலும் நான் பாத்துக்கிறேன். யார்கிட்ட எப்படி பேசணும் நான் பேசிக்கிறேன், என்ன கூப்பிட்டு போங்க, எந்த ப்ராப்ளமும் கிடையாது.
எனக்கு 2 பசங்க இருக்காங்க, என்னால எல்லாமே ரன் பண்ண முடியும் அப்படின்னு சொல்லிட்டு இன்னைக்கு வரைக்குமே யார்கிட்டயுமே போய் நிக்கல. என்னோட மதர் சைடும் போய் நிக்கல, இந்த சைடும் போய் நிக்கல. என்னால தனியா ரன் பண்ண முடியும்னு ஒரு தில்லு, தைரியம், ஒரு தன்னம்பிக்கை கொடுத்தது வந்து இந்த ஜாப் தான்.
இப்போ இன்னைக்கு கூட 5 ஃபோன் வந்துச்சு ஊசி போடுறதுக்காக வேண்டி. நான் வந்து போட்டுக்கோங்க, எப்படின்னா ஈவினிங் போடாதீங்க, மார்னிங் போட்டுக்கோங்க. காலையில் இப்போ கூட சொல்லி 4 ஃபோன் அட்டன் பண்ணி பேசிட்டு தான் வந்தேன்.
அதாவது காசநோய் இல்லை, உங்களுக்கு எந்த நோயா இருந்தாலுமே போய் அங்க சின்ன சேலத்துல தேவி கற்பாங்க போய் பாருங்க அப்படின்னு நினைச்சேன்.
கிராமங்களை களவிட்டு இருந்தேன்னா, நீட்னஸே இல்லாத இருந்தேன்னா இவ்வளவு தூரம் வளர்ந்துருக்கேன். சாதாரண பெண்ணா இருந்து சாதிக்கவா பெண்ணாவா மாறி இருக்கேன் அப்படின்னா அதுக்கு என்ன எங்க ஆபீஸ் தான் எனக்கு காரணம். அதுக்கு நான் ரொம்ப ரொம்ப நானும் என் ஃபேமிலியும் நன்றி கடன் பண்ணுறேன்.
எங்கள் வார்டில் வந்து இன்னும் கவுன்சிலர் எலெக்ஷன் இன்னும் வைக்கலை, நீ வந்து கண்டிப்பாக நில்லுமா, உனக்கு நாங்கள் சப்போர்ட் பண்ணுறோம், உனக்கு ஓட்டு போடுறோன்னு சொல்லியிருக்காங்க. அதனால் எலெக்ஷன் வந்துச்சுன்னா கண்டிப்பாக நான் கவுன்சிலர் எலெக்ஷனில் நான் ஜெயிக்கணும்னு இருக்கேன்.
இந்த ப்ராஜெக்ட் முடிதா என்ன தொடர்தாங்குது எனக்கு தெரியாது. ஆனால் என் பேஷண்டெல்லாம் நான் ஃபாலோ பண்ணிட்டு தான் இருக்கேன். அடுத்தடுத்து அவங்க என்ன பண்ணணுங்கிறதையும் நான் இன்ஸ்ட்ரக்ஷன் கொடுத்துக்கிட்டே தான் இருக்கேன்.
என்னோட சமுதாயம், என்னோட தலைமுறைக்கு வந்து ஒரு காசும் இல்லாத ஃப்ரீ ஹேரா என்னால் உருவாக்க முடியும்னு ஒரு தைரியம், ஒரு என்ன சொல்றது, ஒரு சேலஞ்ச் வந்து இருந்துகிட்டே இருக்கும் என்கிட்ட.
Thank you all for watching that, and hope you found it as inspiring as we have. And I think for those of us who were in the studio watching these women speak in front of the camera for the first time, I think it's a day that we'll all never forget. So I'm just taking a moment to come to terms with that. So thank you so much to all our wonderful women TV leaders. And I think that's the perfect time to really move on to our discussion for today. And we're very privileged to have with us 8 wonderful, inspiring women. They are TB program implementers, public health specialists, technical experts, scientists, advocates, community leaders and TB champions, social media influencers. And over the next 45 to 50 minutes, we're going to talk about TB, yes, of course, but we're also going to talk about public health in India, why we need more women in public health in leadership roles, and how we can get there. So without any further ado, we'll dive straight into this conversation. And I'd first like to invite Prachi Shukla, Country Director of World Health Partners, and someone we consider a friend of REACH. As country director, Prachi oversees WHP's many projects. She's worked in the social sector for over 20 years, has a degree in law and a postgraduate degree in industrial relations and personnel management. Welcome to the discussion, Prachi, and thank you so much for joining us today. WHP has been doing fantastic work in making health services accessible for all. And I'd really like to ask you, as an organization working in TB for so many years now, how have you been able to strengthen women's participation in TB at multiple levels, both within the organization and in the community? Over to you, Prachi.
Thank you, Anupma, and thank you, Ramya, for this opportunity. And wonderful to see so many people connecting from ground, TB champions and healthcare providers, the team members. It's really heartening. And since the subject is so close to my heart, it also gives me an additional pleasure to talk about how we are dealing with all of these issues collectively, not just one organization as WHP. So just to give you a very brief for all the people who've joined in, that World Health Partners is a non-profit Indian society that provides primary healthcare services to vulnerable and marginalized communities, living both in rural hard-to-reach areas and also urban slums. So, and since we're talking about tuberculosis today, but it also applies to all the other illnesses that we are working together in public health action, that and particularly in the context of TB, you know, and every one of us knows that more men are affected by TB than women, but women experience the disease differently. And gender differences, everyone is aware of. And inequalities play a very significant role in how these men and women access and receive healthcare services, both in the public and the private sector. And talking from my experience now that we have more than a decade long experience in working with the communities alongside with the patients and family members, and also the frontline workers, healthcare providers, it's coming out of all of these observations and experience that we see that these women have have very less access to TB treatment and prevention services than men. This is something that I didn't realize early on, but this is a hard fact. If you go out in very desperate rural areas, and even in areas which are not so desperate, because social factors till today, they also play a very critical role. For example, I've seen women who are suffering from TB, but they face a lot of difficulty accessing not just TB treatment services, but going to a normal doctor for consultation because their husband or a male family member is unwilling to pay the consultation fee or any fee for those services that she needs, because it is considered in those households that the women's health is not as important as that of a male family member. And also because TB in women is more stigmatized than men. There are instances where the mother has come to us saying that please don't let this word out that my unmarried daughter has TB, because if it spreads out, no one is going to marry her. Or there are instances where the husband divorced the wife or left her alone to fend for herself and the family members. This is the scenario that we are till India of today is facing. And this is just the community side, and there are many more stories to it. But from the healthcare infrastructure, from the public health or private health sector side, our system is very gender insensitive. So we have a gender insensitive healthcare infrastructure, which also impacts on women's access to services and care. You've seen, and I know, met so many women who complain about lack of privacy in the health centers when they are receiving any kind of treatment, whether it's not just leave alone TB, if they're going to see a gynecologist for any women related issue or even a normal consultation. So they lack of privacy, the behavior that they are subjected to, they are disrespected at a lot of times and during a lot of points where they have to access care and treatment. These are all things which are true. Even from the frontline workers side, we've seen that whether it's an ASHA or an ANM or even the Anganwadi workers, they have a very minimal say in the entire decision-making process. And they are very hesitant to even bring up matters to their supervisors because, quote unquote, he will not understand. That is a very simple thing, that they still are not able to freely talk to their supervisors about any kind of gender disparity and inequality or whatever they are facing and experiencing. So giving you this context doesn't mean that as World Health Partners, we have mastered everything. No, it's work in progress. We are still kind of moving one step at a time, because we also had, when we initially launched our projects early on, we also had our share of challenges. And being a woman myself, sometimes I couldn't relate to this topic of gender and how could it impact into healthcare services and access or affordability. But slowly I started realizing that the problem is very deep and more so in rural areas. So, and as one of the previous speakers said, that we in WHP, we're also following and we have adopted this gender responsive approach. And it's not just to for the TB projects, but all aspects of our programming. We work on the principle of non-discrimination, informed choice and consent, confidentiality, privacy, respect for all, and fostering accountability and empowering communities. This has been now are very basic pillars that we apply across all the projects and services that we render. And we also follow a three-step process, because for us it is very important to understand the gender perspective and how the gender perspective is also affecting the response to any kind of illness. For that, we invest and we orient capacity build, not just our teams, but the community, the healthcare providers that we work with. And of course, the second step is how do you regularly conduct assessments, generate data and evidence, and then use that data to course correct your project. So this is something that we have been doing in the past, and we are slowly improvising on it, looking at best practices, seeing how other organizations are working, and then adopting it. Obviously, we also have a very specific gender focal person in the organization that cuts through all the projects and programs and is available to not just our team members, but also to the community to address any kind of issue or challenges the community or these workers might face. So this is what we do in World Health Partners, and we are trying to improve day by day.
Thank you. Thank you so much, Prachi. And I think, like you said, no, it's very much work in progress for all of us. And it's something that we have to keep chipping away at and hope to make a difference. I'd now like to turn to Dr. Asha Frederick. Dr. Asha is State TB Officer of Tamil Nadu. She's a medical doctor with a public health background and someone who's worked extensively in various roles in the public health system. She's again someone we work very closely with. She's always open to new ideas and is a sounding board for us when we want to initiate something new in Tamil Nadu. Welcome to this webinar, Dr. Asha. And I'd like to begin by asking you, picking up from what Prachi was saying, as someone who's been working with and observing people affected by TB for several years now, how do you think the experience of the TB care cascade, the journey itself, from the point that someone develops symptoms to when they're cured and they begin to cope with life after TB, how's this journey different for a woman? Over to you, Dr. Asha.
Hi, good evening to everyone. And first thank Harich for inviting me. So coming back to your question, so what I would actually thank you for the video or the film. So I was also very much happy, and I had to take a moment after seeing this, although we have heard these women before, having worked with them closely in this TB Allies project. So I just would once again like to appreciate all these women TB leaders. So when we first, when Dr. Ramya talked to me about this, it was, it was, I immediately became attached to the project because it is, something like converting the women who are victimized by tuberculosis into heroines in their own life. Because, empowering them, improving their capacity and using them as ambassadors for the very same infectious disease, which is really a scourge. Even as my previous panelist, Dr. as Prachi was saying, the stigma is still attached. There are many women who do not have access to care in India. They're frightened to disclose that they have such an infection within the family. There is a, as one of the TB champions who survivors disclosed that they've been, dished by their own family. So all this still happens, and but from that, bringing them and developing them into champions, these survivors into champions and as ambassadors in their own community, and in fact they have become an asset to the program. So when these women TB leaders were there, so all the district TB offices in which districts they were supporting the program, such was the support that these women TB leaders gave to the program, that we did not want this project to end. In fact, we wanted the entire Tamil Nadu, we have almost 30 other districts that needed these women TB leaders and so on. So when we gave our feedback, that's what we told them, that they are such an asset to the program. We have, we have to somehow bring this into the program, have more women. So because women inherently have this in the genetic. We see they are the maternal instincts, the nursing, the nurturing, all that comes very easily for women, and that is what is required. That is what is lacking, and that was required in the in the care of TB patients. So these women were able to do that, and that's what I observed when interacting. And the entire this empowerment has changed many of them. So the way in which they look at life has changed. What was their perception earlier, and after involving them into this particular project and giving them the necessary trainings, and they having evolved as TB champions, so that has really changed them, and that I could observe from what they were and what they have now become. So I'm just they are now an inspiration to me sometimes, even though I've been in this, I've been a doctor and district TB officer, now the state TB officer. And sometimes, when we get low, but you look at these women, and when I had a chance to meet them and interact with them, you could draw such inspiration from each of these women TB leaders, and especially the project. And once again, my all-out appreciations to this, the concept, and to the REACH team for doing this. Thank you.
Thank you. Thank you so much, Dr. Asha. And I think we're really trying to see how we can build on this women TB leaders model and take it forward. We're very happy to have with us today Dr. Camila Rodriguez. As many of you will know, Dr. Camila is a consultant microbiologist and chair of the Infection Control Committee at Hinduja Hospital in Mumbai. She's the current president of the Indian Association of Medical Microbiologists. Dr. Camila has over 300 publications, and she's been a part of over 100 research projects. She's passionate about pushing the envelope for TB and antimicrobial resistance in general. And she's worked extensively to make rapid diagnostics available for people with TB. Dr. Camila is someone who's worked in the private healthcare sector for decades and worked firsthand with people with TB. I'd really like to ask you, we know women are often more comfortable seeking care in the private sector. But if we wanted to push this further and we wanted to ensure that services are women-friendly, what would that look like, and what would we need to do? Over to you, Dr. Camila.
Thank you, Reet, and thank you, Anupama, for your kind words. I think basically, TB, we need to always keep in perspective that TB is one of the top 5 killers in women who are in the reproductive age, especially from 20 to about 59. And if you look at the 4 pillars of TB control, it's basically detect, treat, prevent, and build on. So to me, every TB patient is a complex mix of the drug, the bug, and the host. So why do women actually seek private sector for any TB association? I think it's clearly related to the stigma. And the other point is they want to get on with their household chores. I mean, the reasons that they put forward, you saw in that video, they want to keep it quiet, they want to get on with their lives, and they want to do it fast. So if something can be done faster, then let me tell you, the program has been outstanding in the last 4 years. It has really gone beyond its, the national program. And so it's so heartening to see that this divide will definitely be decreased, the public-private. But I come from a diagnostic background. And so I look to just detect TB. I don't make any illusions about that, because I think accurate diagnosis has the potential to really be the cornerstone in basically changing TB care. For example, if you just treat a patient empirically, you don't know what she has. You don't know, are we really dealing with TB or is it just a PUO? And the other aspect is actually, I come from a hotspot of drug-resistant TB. So we are kind of really obsessed with that. So I want to actually, when I see a woman, I want to make sure who presents with symptoms of TB, I want to make sure that I can diagnose it well, and fast so that I don't waste her time. I want to make sure that she doesn't have drug resistance because the treatment is so completely different that from the start of her treatment, it should be right. So ever since basically the dawn of the anti-TB era, the specter of drug resistance has always loomed like a ghost. And it's now come to fruition because we're really seeing a lot of MDR, we're seeing XDR, we're even seeing TB that can't be treated sometimes. So to me, molecular diagnostics have really been the essence, the turning point. They've really been the game changers, whether it is an expert or whether it's our own Indian homebrew TrueNat. These are delivering tests within an hour. And to me, it must be important not to wait for a day. We try and give our turnaround time by evening so that the patient can next morning come, collect a report, meet the physician and start a treatment because we know now that it is not drug resistant. And just to sort of close with, I think COVID is really threatening to wipe out years of progress in global health. It really has. But it has also had another side to it. It has shown that accessible, affordable, and rapid testing is possible where there is a will. I mean, we have COVID testing that's available certainly across the country within 24 hours. I mean, how cool is that? Was it only because it was COVID that we rose to the occasion? We desperately need to tap on the enthusiasm of policymakers. We need to get funders to foster innovations using affordable approaches. Remember, equity and access is what our patients need, especially our women who are really hard-pressed for time. So if we push TB diagnostics to the fore and make it point of care, if we are able to detect drug-resistant TB at the point of care, believe me, we'd have gone 5 steps ahead in our effort to control TB. Thank you.
Thank you, Dr. Kamala. The drug, the bug, and the host, I think that's something that will stay with all of us. I'd now like to turn to Blessina Kumar, who really doesn't need any introduction to all of us here. Blessina is CEO of the Global Coalition of TB Advocates and co-founder of Touch by TB. And she's been at the forefront for advocating for the meaningful engagement of communities in the global response to TB. Blessy has been a friend and advisor to all of us at Reach and someone whose advice we value. Thank you so much, Blessy, for joining us today. And I'd like to begin by asking you a personal question. You began to build a career and a lifetime in public health at a time when it was not an option for many women. So can you reflect on your personal journey as a woman working in public health, a woman working with communities? What has it been like? Over to you, Blessy.
Thank you so much, Anupama and Ramya, and for inviting me. And I've seen Reach grow, and I'm very proud of the achievements of Reach. But I'm more proud of your connection to the ground, and I'd like to encourage you to keep that at the core of Reach. And I think that's what gives you the edge over many others. To answer the question, it wasn't easy. I've always been a fighter, so it took a lot of fighting to find my space in the public health. It was something that was really dominated by men, and as a young person I struggled. Many times I gave in, but as I got experience, I started actually saying no. For example, it costs us, but I think to achieve something we need to accept that. For example, when I felt I was valued, I could actually say, I will not be on this committee if it has no women. And I would step down. I would not do consultancies with organizations that didn't have a gender policy in place. So those were some intentional approaches that one had to take. But it does cost. Some people agreed and said, okay, we agree, that's a good point, let's make a gender policy. But somebody said, okay, fine, no, if you don't. So I think it's a gamble in a way. And but I think having seen the changes over the years, it has been worth every second, I would say. And I think my work over the 3.5 years in Sudan, I would hold very dear, where working among the displaced populations and actually working with women who were so, to me, what seemed disempowered, what they could achieve, given a little bit of space, value. And that's why the film that you showed really resonated. It made me choke up. And that's why I said, we can close this webinar. They've actually said and shown us everything that we can say and much more. And I think that is important, the courage that is needed to stand up against entities that continue to disempower, discriminate, and alienate. The entities that continue to relve in the imbalance of different groups. And I just wanted to remind that this year's theme is gender equality today for a sustainable tomorrow. So there is no way we can think of sustainability without actually thinking of an equal world where men, women, and other genders as well, we can't stick to this, the LGBTQ community, everyone, whoever is marginalized, whoever is disempowered. I think it is a question of coming together, and I'm so encouraged to see that it is not a lonely fight anymore. There are organizations like Reach, there are individuals like we heard just now speaking, Camilla, a friend, someone I respect immensely, speak out, and other colleagues as well, and especially the Tamil Nadu Dr. What was her name? Dr. Asha. It really encourages me, and I totally agree that we have come a long way, and this is something we need to hold dear and protect in moving forward. Thank you.
Thank you so much, Blessy, for that. And I think for reminding us the choices all of us have to make. Today, we're very, very proud to have with us Daneshwari Yadav, who's a TB champion from Durg district in Chhattisgarh. Daneshwari has been an active member of the Chhattisgarh network of people living with HIV since 2010. And she's been working as a TB champion since March last year to implement our flagship community accountability framework. And Daneshwari is very keen to mentor newly trained TB survivors as they begin their own journeys as TB champions. Namaskar Daneshwari, and बहुत धन्यवाद आज ज्वाइन करने के लिए. मैं आपको पूछना चाहती हूँ, आप टीबी से पीड़ित महिलाओं को सहायता के लिए कैसे काम कर रहे हैं? थोड़ा डिस्क्राइब कीजिए प्लीज. And for the benefit of those who don't understand Hindi, we're asking Daneshwari, in her work as a TB champion, how are you supporting women with TB? Daneshwari, over to you.
आप सबको मेरा नमस्कार. मैं बहुत आभारी हूँ मैम कि मुझे ये मौका मिला छत्तीसगढ़ से. मैं धनेश्वरी यादव, मैं छत्तीसगढ़ के दुर्ग जिले में रहती हूँ. मैं एक टीबी चैंपियन हूँ. पिछले 12 वर्षों से PLHIV नेटवर्क से जुड़ी हूँ और समाज में जो महिलाएं इससे ग्रसित है और शोषित है उनके लिए काम कर रही हूँ. PLHIV महिलाओं में कई महिलाएं टीबी से भी ग्रसित है, जिनमें से अधिकांश महिलाओं को न तो इस बीमारी के बारे में पता था और न ही हमारे बीमारी से जुड़े सरकारी योजनाओं की जानकारी थी. दुर्ग जिले की बात कर रही हूँ मैं छत्तीसगढ़ में दुर्ग जिले की बात कर रही हूँ मैं। जब मैंने यहाँ देखा तो फिर मैंने उनकी काउंसलिंग शुरू की, जिसमें टीबी से संबंधित सभी जानकारियां उनको देने लगी और जो सरकारी योजनाएं उनके लिए है उनसे उनको जोड़ने लगी। साथ ही साथ उन्हें साइको सोशल सपोर्ट करती रहती हूँ, क्योंकि मैं एक टीबी सर्वाइवर थी। आपकी परेशानियों को मुझसे बेहतर कोई नहीं समझ सकता। जब मैं अपना उदाहरण देके उनसे बात करती थी कि हमने क्या क्या फेस किया, जब हमको पता चला था उस समय हम क्या क्या फेस किए हैं, ये सब चीज उदाहरण दे के जब मैं उनसे मिलने लगी, बार बार बात करने लगी, तो वो खुद से मुझसे जुड़ने लगी। एक टीवी चैनल के रूप में मैं कार्य करते हुए मैं जितनी भी महिलाओं से मिली जो टीबी से ग्रसित है, उनमें से कई महिलाओं के अंदर स्टिग्मा है। जैसे मैम यहाँ पे मैं छोटा सा उदाहरण देना चाहूंगी। स्टिग्मा, सेल्फ स्टिग्मा, सबसे बड़ी बात होती है सेल्फ स्टिग्मा। जब हमको किसी चीज के बारे में पता चलता है और वो बिहेवियर कि सामने वाला हमसे किस तरह से इंटरेक्ट कर रहा है, तो सेल्फ स्टिग्मा अगर किसी के अंदर, चाहे वो PLHI हो या टीबी चैंपियंस हो या टीबी सर्वाइवर हो, जब उनको खुद की जब प्रॉब्लम पता चलती है, जब हम किसी चीज से जूझते हैं तो क्या हम फेस करते हैं, तो वो फेस जब हम करके सरवाइव करके हम उस चीज से निकल के जब हम आगे बढ़ते हैं, तो फिर मैंने अपने उदाहरण देते हुए बात की कि कैसे हम सर्वाइवर टू टीबी चैंपियन बने। कई महिलाओं ने अपनी दवाइयां बंद कर चुकी थी, बीच बीच में वह जो उसके साथ साइड इफेक्ट होते हैं उनके कारण से वो टीबी की दवाइयां बंद कर दी थी। शुरू में वहां मुझसे भी कुछ नहीं बताती थी, लेकिन धीरे धीरे जब मैं लगातार उनसे मिलते रहे, फैमिलियर हुई उनके साथ, उन्हें अपने बारे में बताकर उनका विश्वास जीती, तब वही महिलाएं अपनी बीमारी से जुड़ी हर बात के लिए मुझे कॉल करती है और बताती है कि कैसे उन्होंने अपनी दवा कंटिन्यू कर दी है, कैसे वो जुड़ के काम जुड़ी है और अपनी दवाइयां शुरू कर दी है। मैं हर तरह से टीबी से ग्रसित महिलाओं की मदद कर रही हूँ, क्योंकि मैं एक टीबी चैंपियन हूँ और टीबी मुक्त छत्तीसगढ़ फाउंडेशन दुर्ग जिले की मेंबर हूँ। यह बात दुर्ग जिले में लगभग सभी को पता है, जो यहाँ के स्टेक होल्डर है उनसे भी मैं बीच बीच में मिलती हूँ, तो उनको भी पता है कि कैसे मैं टीबी मुक्त फाउंडेशन की मेंबर हूँ और कैसे मैं जुड़ के उनसे सोशल वर्क कर रही हूँ और कैसे कैसे मैं महिलाओं और बच्चों पे काम कर रही हूँ। तो कुछ ही समय की बात है मैम, जैसे किसी भी महिलाओं के साथ या फिर बच्चों के साथ कुछ भी गलत होता है या अत्याचार होता है, तो सबसे पहले वो मुझे बताते हैं। तो एक एग्जांपल दे रही हूँ मैम, अभी कल ही की बात है, मेरे पास रात के 9 बजे फोन आया था दुर्ग थाने से। उन्होंने कहा कि एक बच्ची को कोई अज्ञात व्यक्ति चुरा के बेचने के इरादे से लेके भागा है। वो 140 किलोमीटर आगे कोई हॉस्पिटल से चुरा के उसको लेके जा रहा था। मेरे पास फोन आया तो मैं गई, 9 बजे हम लोग गए वहां पे। उस बच्ची को ले जाकर वहां के जिला अस्पताल में उनका मेडिकल चेक करवाए, पूरा रूटीन चेकअप करवाए, मेडिकल करवा के उनके पेरेंट्स के पास उनको सही सलामत उनके माता पिता के सुपुर्द किए। तो ये मेरे लिए एक अच्छी चीज थी कि मैंने उसको सरवाइव दिया, ये मदद किया। अब वो बच्ची अपने माता पिता के पास सही सलामत पहुंच गई है, अपने माता पिता के पास। मैं हर तरह से महिलाओं की मदद करना चाहती हूँ, करती हूँ। मैं टीबी चैंपियन हूँ, इसलिए मैं चाहती हूँ कि सभी टीबी से ग्रसित महिलाओं को सही समय पर इलाज मिले, उनके साथ भेदभाव ना हो और समाज में उन्हें बराबर का सम्मान मिले। क्योंकि मैम जब ने हम फेस किया था, जब 98 की बात करें या 2002 की बात करें, उस समय मैम ये सुविधा नहीं थी। हमने जो फेस किया था उस समय, ये चीजें देखने में आता था कि कैसे हमारे साथ दुर्व्यवहार करते थे, भेदभाव। क्योंकि हम छत्तीसगढ़ में रहते हैं, ग्रामीण क्षेत्रों से बिलोंग करते हैं, तो आज भी वहाँ छुआछूत, भेदभाव, अंधविश्वास अभी भी हमारे यहाँ मानते हैं मैम। इस चीज को हमने देखा है, कैसे हमारे कपड़े अलग करना, कैसे हमारे बर्तन अलग करना, कैसे हम हमारे साथ ही मिसबिहेव करना। तो इस तरह से जब हमने खुद देखा कि जब मेरे साथ ऐसा हो रहा है तो क्यों ना मैं महिलाओं के लिए, बच्चों के लिए कुछ करूं। तो इस तरह मैम मैं टीबी मुक्त छत्तीसगढ़ फाउंडेशन से जुड़कर मैं ये काम कर रही हूँ। थैंक यू मैम।
Thank you so much, Dhaneshwari. So we are so proud of you and all our TV champions. And I think you're truly inspiring for all of us. We now go from one TV survivor to another, and we're very excited to have with us today Sherizade Shroff, who's a fashion, beauty, travel, and lifestyle content creator. Sherry is known for her vivacious energy and for the from the heart, genuine content that she puts out on YouTube and Instagram. And she was one of the first YouTubers in the country and has had over 50 million views on her content. We first met Sherry around 3 years ago when we were making a video series featuring women in collaboration with USAID and the Mumbai US Consulate. And at that point, Sherry was recovering from TB. Thank you so much for joining us today, Sherry. And I'd really like to ask you, as someone who is very open about being diagnosed with TB, what was the kind of response you got from young women who are your followers? Over to you, Sherry.
Thank you so much.
For me, I think it was a bit of a mixed emotional experience because I never ever thought before sharing my TB diagnosis. I think I was diagnosed, and I think within 3 days, I had already posted on Instagram saying, this is what's happened to me because I was ill for a month and no one could really figure out what was wrong with me. And that's when the reaction started pouring in and people were like, oh my God, you're so brave to share this. Or, and I was just like, why is it so different? If I had malaria, if I had cancer, if I had any other disease, I'd be doing the same. So I didn't really think about it as, oh, I've got TB. Should I be talking about this or not? It just happened naturally because I share most of my life with, people who watch my content. And that's when the reactions as they poured in, I was like, wow, okay, this is clearly something people are not comfortable with. Or a lot of young girls were privately messaging me saying, I faced this, or my family didn't let me speak about it. And as someone mentioned earlier, saying that it'll be an issue for me to get married, and this is what I was told. And it was a bit surprising, of course, to kind of like hear that and see that in today's world for me, because I was like, okay, it's such a normal thing when you're sick to be, saying I'm sick or this is what's happening to me and I'm recovering. And after that, I think a lot of people, were saying that, oh, I'm going to share this with my mom and tell them that, see, you're talking about it and you're just another girl like me, and it's not a big deal to kind of share this or say that I've had TB in the past or that I have TB right now. And I was actually surprised at how many people were trying to, like keep it a secret and go through that treatment, because it's not easy as a treatment. It's one of like, the tougher diseases with regards to side effects and medication and stuff like that. And I was really surprised that people had to go through that for 6 months or a year without actually sharing this with, even close friends and family. And so, yeah, that was, it was eye-opening, definitely. And that is kind of what got me more vocal about it, where I was like, if this is the situation, I would like to use my platform to kind of raise more awareness about TB, about the disease, about how we can get better with, just communicating about it. Because I feel like that was the biggest thing I felt, where people were like, oh, or there was this question of how can you get TB? Like it was, a disease that, or, I couldn't get. And I was like, why would you ask me that? It's like anybody can get any disease. And so I think all of these stigmas, had to be broken, had to be spoken about, which is what kind of encouraged me to speak more about my experience. And I was lucky to have a sensitive strain that was treated pretty quickly and I recovered pretty fast. But then I felt that there's a lot of people that have not been that lucky. So even for them, I still, even years later now, get messages from girls saying, I watched your video on YouTube and I currently have TB and it's it feels good to know that there's someone that's been through this, and now to see you the way you are, I feel like I'm going to be happy and okay. And that definitely makes me very happy when I read those messages.
Thank you so much, Sherry. And I think it really makes a huge difference, when women like you speak up openly and just show that there's absolutely nothing to be ashamed of. Thanks, Sherry.
Thanks.
Just like to move on now to speaking with Dr. Daksha Shah. We're very happy to have you with us, Dr. Daksha. Dr. Daksha has joined Executive Health Officer at the Mumbai Municipal Corporation of Greater Mumbai. She's been working for over 25 years in the BMC. She's handled H1N1 pandemics, malaria outbreaks, the NCD program, and most recently, of course, been part of the team working for the COVID-19 response. We, of course, know her best from her time as a City TV officer for Mumbai. Thank you, Dr. Daksha, for joining us. And I'd really like to ask you, as someone who's been part of the public health system for over 2 decades, can you reflect on what your journey has been like as a woman working in public health, and what have been some challenges and opportunities that have come your way? Over to you, Dr. Daksha.
Thank you, Reach, and thank you, USID, for this invitation on this webinar. And I'm really been privileged to be on this panel with wonderful friends, as well as all the leaders. I think the film which you showed really touched me, and it took me back to my 2003 and 2002, when I was deciding to change my gears from clinical side. I was working in the hospital, and I had to make a decision whether I should go on the administration side. I think that was very changing time in my life. And I thought, for a greater good, and working in the system, changing the system, it will be important to go on that side. So of course I switched over, and my first posting was in HIV/AIDS program as a deputy director in MDEX, Mumbai District AIDS Control Society. If I reflect on my stint in MDEX, at that time, the care and support services was just evolving in the program, if you recollect. And when I was working to develop some ART centers and CD4 machines, and we were buying the pediatric ART drugs and everything, what we realized, and particularly I was watching, is the women, especially those who are widowed, and women who has been affected because their family was not ready to accept them once they are diagnosed with HIV. They're orphan children, and many commercial sex workers. So we were working with many groups. And at that time, I realized that what is most important is to provide a social support to the women. And especially when we are dealing with, disease like HIV, and same as then later on, for the TB, a lot of stigma, a lot of discrimination in the community. And we needed to work more closely with the community groups. So nothing then, more better than, working on rehabilitation. How do we provide the rehabilitation services? So I still remember, we started some small projects, which is called Setu. And in that, we supported women who were been, not taken back in the families. And we provided them with the sewing machines so that they can, generate some income. And there was a huge space which we got it. And, through the program also, we supported, that center, the rent for that center. And similarly, we took up some programs for the orphan support, even for the commercial sex workers, and so many such small groups. I remember working in with the SNDT, principal. I think Mary Madam was there as a SNDT principal, and we gave them some grants from the program. And I think it was most satisfying, when the women came back so happy that they got some social support, because they were being rejected by their own families and their own friends, etc. So I think this was my first stint, and having seen that what I can do, I was really motivated. And then, as I went ahead in my career, I saw that the public health is more of people. It is more about community. It is more about policies. It is more about, a lot of patients, and of all, a lot of pressures. So being into the administration and the government side, I think we face a lot of pressures from different groups and from different, sets of people. But again, we have to keep our calm and keep working. Having worked in H1N1 outbreaks, during malaria outbreaks, and recently with the COVID-19, I think we have to sacrifice our time. Most of the time we work overnights, and during the emergencies, all holidays are fired. And I still remember, carrying out the monsoon camps almost for 3 months, not a single leave, and so forth. There are many stories like that. But the most satisfying work, is working with the women and seeing that, you are able to bring some changes, building up your own team, because it's not just you who are working. You have to always develop a first level, a second level of your teams who also is equally responsive, who are equally sensitized regarding the needs of the community and the people who are working in your office. So it was very important to connect the grassroots workers with our own office staff, with the officers, and develop a kind of a connections, even the partners and the CSR donors. So all these connections and making sense of what the program is. And the most satisfaction work was, of course, TB. By improving the access to the TB services, developing a program like PPP program or PPIA. And I was very happy that Mumbai could show the model, and this was replicated all over the country, the PPI services, and we could have the notification of TB, say around 17 to 18,000 in the first year itself, and we could integrate the entire PPI program into our healthcare system. So I think this was something which was really encouraging. And all throughout my journey, I would say I got a lot of opportunities as a public health person. I had some very good gender equality. I never faced any gender discrimination as such. In fact, I got a lot of support from my even man bosses. I would I would really say that. And I'm happy that we are also working towards providing same to our other officers and other in the system. So I think it was overall a very good journey, and I look forward to have now work on the NCDs as well as the family welfare portfolio, which I've received right now. And I would say that, making the woman-friendly services is most important, and we can discuss this later. But I feel that this particular topic which you are discussing today, with so much of experience on the dais, definitely, there are certain points that definitely something to reflect on, and definitely to improve our services, and more sensitive towards women. Thank you.
Thank you. Thank you so much, Dr. Daksha. Last but absolutely not the least, I'd like to turn to Amy Piatek. Amy is the Senior Tuberculosis Technical Advisor at USAID Washington, and she spent over 12 years with USAID and currently leads the TB diagnostics and lab portfolio. Amy's worked extensively in multiple countries, including India. She's been part of the last 4 JMMs and led the external assessment of India's TB diagnostic network. Amy has a Master of Science in Epidemiology and Infectious Diseases. Thank you so much for joining us today, Amy. And I'd really like to ask you, as someone who's been in USAID for over a decade, how do you see yourself within USAID, and what's been the participation of women in leadership roles in the organization? If you could reflect on that. Over to you, Amy.
Thank you, Anupama. It's so nice to see you. It's so nice to see all of the other panelists. You realize, how the pandemic has really kept us apart. I'm used to coming to India quite often, and I haven't been there in quite some time, and hoping that will change. I'm hoping in 2022 we'll be able to come and to see all of my colleagues and friends as we have. And I'm so honored to be part of this discussion and this panel. The women on the panel are so inspiring, and it makes me realize, what I've chosen to do is the right thing. And I just, I just get so inspired and so excited to continue this work and to help support all of the activities, that all of you are doing. The video was just so moving, and it makes me feel part of something, that USAID has been able to support something like that, and to realize that now it's really part of the USAID portfolio. I think when I first started supporting India so many years back, it was a very different portfolio that we supported. And I almost don't remember, right? I mean, I feel as though Now it is, the work that REACH is doing and the work that WHP, and all of our implementing partners are supporting is so critical. And the reach within the community, which wasn't something that, was there necessarily, when I started supporting India so many years ago. And now that it's ingrained, right, into what we are doing every single day is absolutely wonderful. So yeah, I mean, I have been part of over a decade, that does seem like a long time at USAID, but yet it doesn't at the same time. Back when I started in 2009, I was part of a very small team supporting TB. I think there were 4 or 5 of us, all women, actually, when I was reflecting on that earlier this week. In fact, it was a woman, Dr. Amy Bloom, who really lobbied the US government to start putting some money towards tuberculosis. Started out very small. And, now, we are supporting, in some pretty significant way, 24 countries and many more countries, with different investments. And now we've grown, more than 30 people, dedicated just for tuberculosis, which probably isn't enough, but still the vast majority of our team continue to be women. And the great thing about USAID is that there's never been, I feel like, a ceiling, for women. We've always been a voice. We've always had the ability to bring in the importance of women and youth and children and girls, into our programs. We've been led by, Sherry Vincent, who is the team lead for TB, for many, many years. We now have a very engaging, very, very important leader in Samantha Power right now with USAID, and who's continuing to really prioritize a lot of the issues that are very important, especially to India. And even within our mission in India, we have Veena Reddy, who's our mission director, Karen Klanowski, the deputy mission director. So 2 women leading USAID India. And then Sangeeta Patel, who's one of the biggest champions, who I've ever worked with, leading our health office in India. And our wonderful champion Amrita, who has really, over her years being with USAID, has made this an important cause, and we can see so many different investments and so many different products and tools and more importantly, just people, right? I mean, the bringing forth the voice, which I think it's always been there, but it just hasn't been elevated. And that is something that, I'm really proud to be a part of, and to help contribute in any possible way, in such a small little piece that we can do. I remember, when my first few times coming to India, like often I was really sometimes the only woman in the room, when we were speaking at that donor level, within the ministry and even with my colleagues. And it's so amazing to see, how that dynamic has shifted, rightfully so, and I don't really see that slowing down at all. And, for as long as I can remember, USAID has prioritized the role of women in our activities, either as direct beneficiaries of our services, or as we can see here, as project leaders, as implementers. And they've really come, stronger and stronger over time. So yes, we have had women in leadership roles at USAID, but it's more so now, right? And we can see a direct correlation between the amount of women that are, helping to lead these programs and the actual number of activities that are happening. And we're seeing impact, right? We are seeing more people being diagnosed with TB. We are seeing more people finishing treatment, and that's incredibly important. So, I certainly have not had the amount of experience or expertise as, my esteemed panelists, but it's just, again, thank you. It's just been a privilege to be part of this, and I look forward to meeting you all again in person. Thank you.
Thank you. Thank you so much, Amy. And I'd now like to hand over to Dr. Ramya to take this conversation forward. Over to you, Dr. Ramya.
Thank you, Anupama. So we are now going to have a second round of questions to our panelists. These questions are going to be discussions on gender equality, women's engagement, what does women-friendly services look like, and way forward. So the first question to Dr. Prachi, I think it's very important that all of us have role models when we work in public health. What do you, in your opinion, can you reflect on how we can have more women in leadership roles as role models in public health?
So thank you, Ramya, for the question. And very recently, the National Family Health Survey 5 was released. And I think India's decades-long effort to improve the sex ratio is now finally bearing fruits. And we see that for every 1,000 males, the country now has 1,020 females. So that is how it's kind of now, there's a strategic shift that is happening. But if you look at the other side, that this is a slightly dated statistics, but from 2019, that only 3.7% of women occupied a role of a CEO or managing director in companies in India. So that is how it kind of pans out. When we talk about gender equity, I think it is very important to the attainment of healthy lives and well-being of all, and then promoting this gender equity in leadership role in health sector is an important aspect. And traditionally, as we all know, that the social sector has attracted more women generally, but that's not enough. Having just more women out there will not work out to the way and to the processes and the changes that we are expecting. More women are required in senior positions because they bring more empathy and a natural understanding of communities and the strong need to foster and work with all the participants and have that partnership mode on to bring about these social changes, which clearly is not coming forward as of now. And I could see these, I could kind of categorize these issues into very basic points. And these are 3 points where you could see that how there are challenges which are related to how do you climb this institutional career ladder. Second biggest challenge for all the women out here is that how do you balance this work-life balance, the career and family responsibilities. And thirdly, and we all know, health and safety issues. So coming from that point of view and now heading an organization and leading a team of many men and women, young men and women, I think it is very, very important for us and for everyone, because my seniors and my supervisors had given me an enabling environment. They mentored me. They oriented me. They were very open to discussing issues, and there were a lot of flexibility around. I think this is what needs to be done. And fortunately, unfortunately, I could say that pandemic has also shown us a different way. How can we work without, there will be disruptions, but how do you make the most when you are not in a very favorable situation where there are obstacles? So I think in the form, the best suited way forward for getting more and more people, more and more women into leadership role, I think we must all focus on succession. That has to be top priority. We need to break down these gendered career paths so that women don't get stuck in job silos that historically females like communications or human resources or support roles. I think the new generation and all of us like to do more and more challenging work, going out in the field, connecting with the community, doing things which from others' point of view seem to be very difficult and challenging. That is something that needs to be communicated widely across. And then secondly, I think that we all need to create a schedule that works for all. because there are many challenges. I said balancing the work life is extremely problematic, because when, even if I am working in office, I have a home, I have kids, I have a husband, I have elderly parents to care for. How do you then expect everyone and each female who's working there to be dedicated and focused into just doing office work? So we will have to build in those flexible schedules for them to work out. And again, pandemic has shown the way. Work from home to an extent has also changed a lot of our perspectives, a lot of our understanding. And thirdly, I think obviously we will have to invest into education and then skill building overall. That this is something which is very important. Equal opportunity is something that I think we need to give it out to all the women who are working, irrespective of what position they are currently, because that is something that mostly we see missing. Obviously, the scenario has changed and a lot of focus has been given to this, but still there's a long way to go. So achieving meaningful change will require us to move beyond just fixing the women towards a more systemic institutional approach that acknowledges and addresses the impact of this unconscious gender-linked bias. And I think we all are doing in our capacities, the organizations that we are working together now. I can see that a lot of change and improvement has come into place. Earlier, where there were hardly 2 or 3 females in each organization that I was interacting with, I can see a lot of young females, women coming in and providing and doing all sorts of work, which is absolutely, absolutely heartening to see. Thank you so much, Ramya.
Thank you, Dr. Prachi. And I think my second question in my rapid fire round, because I think I just saw the time and we actually have only 10 minutes to 6 o'clock. So I think my next set of questions is going to be like a rapid fire round. So my next question to Dr. Camilla, how can we have more women at the forefront of scientific research? Can you please share your thoughts on that?
Thank you, Ramya. I think science is basically a traditionally male-dominated field, but actually women and science are a perfect fit. And juggling family responsibilities is not a reason to abandon a career. Believe me, TB is an example where you can look at the community and look at what you want to focus on. I mean, just to quickly tell you, in 1992, we read an article that said Gujarat had some high MDR rates. Our clinicians in Bombay were grumbling that we also are seeing patients not responding to. So we set up LJ in a private hospital. We set it up. We found that we did have a problem. We moved to automation. Our hospital supported us. Today we have more midgets in the whole country. And so how do you get women? I remember at that time, one of my PhD students, a girl, she actually set up a RLBH, a reverse line blot hybridization assay, that was doing LPA much before the country had LPA was even launched in India. And today LPA is our go-to test for detecting XDR-TB. So how do we get women to work in science? I think one is find a mentor. I certainly found mine, Dr. Ajita Mehta. I think a mentor should preferably be a woman because she will understand you. She will help you make less mistakes. We need other women also to empower us. I think you need to think big and think bold. That's so important. Don't be worried about what people will say she's working in TV. This is the best thing to do because when you're working for a noble cause, believe me, help comes from the least expected places. Your mother-in-law, your grandmother-in-law, somebody will help you with your family. So I think that needs to be told to women as they start out their career. And believe me, once you're committed, you will become a leader. Thank you.
Thank you, Dr. Camilla, for that very practical suggestions. A question to Dr. Daksha. So if we want to make public services more women-friendly, so what are the top 3 things that we need to do now?
Thank you for the question. I think, Ramya, we need to first, think at the 3 levels. First is, of course, in the public services, you need more women leaders. So I think more opportunities and more courses, which is orienting women in the governance and leadership, give them more growth because they can shape and change and they can also integrate the needs of women into the policies and policies into action. So probably, you require not just the public health knowledge or medicine knowledge, but you require, overall knowledge about the governance and the systems and how they can make some better policies and the plans. The second is at the level of your health workforce. Like, we have a lot of CHVs, ASHAs, ANMs, we have TBHVs. Now, how do we make our, the work environment more woman friendly? So probably, as Prachi has already pointed out, that the more flexible work hours, probably work from home options, whether that's possible for the field staff, and, our own centers, the primary health centers has to be safe, cleanliness, basic water sanitation facilities, if it is in the rural or the urban areas. And also, I would say that some insurance kind of system for their own health benefits, as well as, the nutrition packages, if possible. And again, there's something called as gender budget. I'm here to see, how best we can utilize the gender budget to benefit our employees, because these women are ultimately workforce and they are going to provide the healthcare services to the community and the women and the families. So I really feel that we need to work on them. Gender equity is one, of course, giving more opportunities in the pays, pay rise, etc. So this is the second level. The third level is your healthcare services, how we can make them women friendly. So first, again, I think is the safety and the security, providing some security cameras in the centers. Cleanliness is another thing. Sensitization of the staff for behaving nicely with the women and sensitization of them. Also, I would say the timing of the centers should be suitable. Places where, which is more friendly to the lactating woman or the pregnant woman, for the resting place, etc. And also, I would say that there are certain services and certain places where there is grievance redressals, and where we can also provide services for stigma and for social issues. So we can provide like Dilasa centers, which is already there in NUHM. So more budget should be provided into NUHM as well as into RCH and RBSK. Which is more women-oriented services, and I'm sure it is already integrated, and how it is up to us how we implement it. So at these three levels, we can improve the healthcare system and the services for the women.
Thank you so much. We already got a lot of huge checklist based on what you shared. The next question, Sherry, how can we help women affected by TB amplify their voices like how you did and be heard?
I think there needs to be more outreach in terms of, not just reaching out to TB champions, but even other influential voices to speak about TB to kind of reduce the stigma, because I think it's really it's easier to share your TB story and to be sensitized towards the disease when you've had it and felt it. But I think it's important for people that don't have it also to understand what people go through with TB, and, how anybody can get it, as I said. And just basic, do's and don'ts, prevention, how you can help someone that has TB, just basic information, because I feel like we all lack that. Until I had TB, I didn't really know, that I had to be on medication for 6 months. So any of the basic information, which I already should have, just like we're aware about other diseases, I think the main thing is to raise awareness about TB.
Great. Thank you for that very short and sweet answer. Next question to Daneshwar जी, आपको क्या लगता है ज्यादा टीबी से गुजर चुके महिलाओं को टीबी चैंपियंस बनाने के लिए हम कैसे प्रोत्साहित कर सकते हैं, कैसे उनको हम सशक्त बना सकते हैं? Daneshwar जी. मैं क्वेश्चन रिपीट करूंगी.
जी मैम, मेरी आवाज आ रही है आपको?
हाँ हाँ
जी मैम, हम एकदम सही बोल रहे हैं और बहुत अच्छा हमने इसके लिए कार्य कर रहे हैं. जो महिलाएं टीबी से ग्रसित है और उसको ठीक हुए और एक टीबी चैंपियन के रूप में काम करने के लिए सबसे पहले इलाज के दौरान ही उनके अंदर छुपे भेदभाव को दूर करने की जरूरत है. बोलते हैं मैम, फर्स्ट इंप्रेशन लास्ट इंप्रेशन. जब हम पहले बार रिपोर्ट लेके हम जहां जाते हैं या जिनसे भी हम पहले इंटरेक्ट होते हैं, उस समय सबसे पहले जरूरत होती है कि उनके अंदर भेदभाव ना हो और ना करे वो चीज. मुझे उनके साथ एक अच्छा रिलेशन बिल्ड करना होगा जिससे कि उनका ट्रस्ट मुझ पर बना रहे. जो भी टीबी सर्वाइवर टीबी चैंपियन की तरह काम करने के लिए तैयार है, तो पहले उन्हें 3 प्रशिक्षण देने की जरूरत है, जिससे वे टीबी चैंपियन बनने के लिए एलिजिबल है। वे अपने ग्राम पंचायत में टीबी चैंपियन की तरह काम कर सकते हैं। साथ ही टीबी विभाग के अधिकारियों से वकालत कर टीबी के स्कीम का लाभ पहुंचाने में मदद करना चाहिए, जैसे स्पुटम ट्रांसपोर्टेशन, ट्रीटमेंट सपोर्टर, फर्स्ट इंफॉर्मेशन एक्स्ट्रा। इसके अलावा भी वह टीबी मुक्त छत्तीसगढ़ फाउंडेशन के नेटवर्क मेंबर बन सकती है, क्योंकि रीच संस्था द्वारा दुर्ग जिले में नेटवर्क के सभी मेंबर को इनकम जनरेशन की ट्रेनिंग दी गई है, जिसमें एलईडी बल्ब को असेंबल करना और मशरूम उत्पादन के बारे में सिखाया गया है, जिस पर हम सभी मेंबर अभी काम कर रहे हैं। वह भी जुड़कर इसमें आय का स्रोत बढ़ा सकती है। तो इस तरह से मैम कुछ इनकम जनरेशन का हमने यहाँ काम शुरू किया है। और अभी भी मैम आपको होपफुली बता दूं मैम कि बहुत सारे कॉल आना शुरू हो गए हैं कि दी आपके साथ हमको जुड़ना है, दी हमको और काम करना है, आपके साथ मिलके हमको भी इस संस्था में जुड़ना है और काम करना है। तो इस तरह से हम लोग यहाँ दुर्ग छत्तीसगढ़ मेंबर काम कर रहे हैं मैम। थैंक यू।
Thank you very much. And I mean, it's so fantastic. I feel the second session has been so productive because all the suggestions, very practical suggestions, which all the panel members have given, it's coming up for a very good set of recommendations that we can take forward. Over to Amy. Amy, as one of the biggest supporters of the cause for TB elimination globally, how does USAID ensure that TB investments programs are gender responsive, and how do you factor in the specific needs of men, women, and the transgender persons?
Yeah, thank you so much. I will be very brief. I know we're at the end. So USAID really has made a huge effort in this area over the last several years. We have a global network of more than 180 gender advisors and points of contacts. They're embedded within our missions, including USAID India, and also, throughout all of our units in the agency. Together they work to integrate gender and advance gender equality objectives in all of our work worldwide. We do have a gender equality and female empowerment policy that aims to improve the lives of citizens around the world by advancing equality, empowering women and girls to participate fully in the activities and the development of their own societies. And this is true for all of our interventions, including TB. We also, we have to be held accountable, right? We have indicators, we really monitor the performance. We ensure that these things are put into all of the work plans that our partners have. We review them. We have teams that are experts in this that are really guide and make sure, even when we're developing and designing the projects that we do, it clearly has to have an important, gender component. And it's not just a check the box activity, right? It really is an analysis and looking at what are the needs, what are the needs of India in this particular area, and how do we ensure that we're able to meet those needs. And lastly, I think, the best way for us to continue is to have these types of discussions. It's really to advocate for, more projects like what Reach is doing, in India, and really to, show and broadcast, the champions, the TB champions of India throughout all of our projects worldwide, and to get this as a real movement. I think that's the really powerful thing. Fortunately, even though, I do directly support India, I have a lot of other activities that I work in other countries, and any opportunity that I can, bring this experience to others, and so we can hopefully learn from what's happening here and bring that to every part of the world. So thank you again.
Thank you, Amy, for that. And my last question to Blessy. As we spotlight on women such as yourself who are agents of change in the TB space, what are the 2 top things we need to improve women's participation in TB?
Thank you so much, Ramya, for that. And the balance is really tipped against women. And I'm talking about women like the ones we saw on the film, like Dhaneshwari. And, any kind of efforts to make this equality a reality needs to be intentional. It needs to be deliberate to invert that sort of power dynamics. So when we're talking about gender responsive or gender transformative TB response, we need to look at 4 things. Very quickly, I'm going to go through that. It needs empowerment, visibility, enforcement, and sustainability. Now, when we talk about empowerment, it's become the catchword. All of us talk about it. But for me, I'm looking not at those of us who have the agency, but those like the women that we, are here to serve. Now, some of the indicators for me of empowerment would be how many women TB survivor networks are registered? How many of them are independent? How many of them are able to get funding on their own without being dependent on us? Can a Dhaneshwari, can anybody from that film apply to USAID and get funds directly? For me, that would be the indicator of success of our achievement in empowerment. And I think we need to move away from looking at women like that as recipients, but start looking at them as valuable partners. I think we need to really stop saying we want to use them, we want to give them, we want to plan for them. No, it needs to be a collaborative effort. Can we sit across the table and do it together? That's where the real change is going to be. We need to be careful about ensuring visibility for those women. I understand that we need visibility because many times funding depends on that. We all do that. But how do we, the film today is a classic example of bringing that visibility, bringing that voice to the voiceless. So that is a fantastic move. And that's something we need to really keep in mind, making sure their voices are heard, making sure the needs are met. And then this can't just be one-off thing. It needs to be reinforced over and over again. Many of us organizations, we work from project to project. But let's step back and look. How is this going to be when the funding ends? Some of them mentioned in the film, they said whether the money is there or not, whether the project ends or not, my work will continue. Now that is success. When we are no more dependent, that our work is no more dependent. Yes, we need the funds, but how can we make it sustainable? So it's very, very important that we look at these things very seriously. And some of the ways we can do it is help women to register groups. We have classic examples. Self-help groups have been running for 25 years, not dependent on whether there's money or not. So how can we build this into the system? How can we link them with the structures that are already there? The village health and development committees, the PRI structures, the Anganwadis, the Ashas. We will only get results that are sustainable when we are able to strengthen these kind of structures and link women who are working at the ground level like a Dhaneshwari. Whether tomorrow Reach is there or not, TB Mukt Chhattisgarh should go on, isn't it? Whether GCTA is here or not, other things should go on. So I think it's investing in people that is very, very important. And also, I think we should stop working in silos. I know Dr. Daksha is here, champion in the TB world, but TB in a silo is not going to help us end TB.
Agree.
We need to integrate. We need to collaborate with other programs. We need to open ourselves up and say, let's work together. The multi-sectoral approach is what going to help us, is going to help us get to our end. And also many times, I want to just say this, that many times our good intentions can further tip the balance against the women. You know, our humanitarian efforts can marginalize further the already marginalized. So who are we investing in is a very important question that we need to ask ourselves. What are our programs supporting? How are they supporting? What are the results? And I think these are some of the difficult questions that we need to ask ourselves as larger organizations. And I think today has been fantastic. And I do apologize that these are hard questions. We have donors here, we have implementers here, but I think if we are serious about equality, if we are serious about a sustainable tomorrow, gender equality, I think these are some of the questions that we need to ask ourselves, focus on those indicators, and really change that paradigm in our own minds and in the minds of other policymakers and program implementers. Thank you.
Thank you, Blessy, and a big thanks to all our panel members. I think we could actually feel the palpable energy coming from all of you, and I think we are all very enthused, motivated, and inspired. And I think the need of the hour as we recover from COVID is an inclusive and equitable strategy that centers women of diverse backgrounds and experiences in decision making, together with the men and the transgenders, to come up with powerful gender responsive solutions to NTB. Health is a women's right, and healthy women are fundamental in ensuring the health of the families and the communities. So on that note, a big thanks to all our panel members, and over to Anupama.
Thank you, Dr.
Thank you,
Ramya.
Ramya.
And could I quickly request all our panelists to please switch on their videos for our version of a photograph, and request Mehika to quickly do the honors, please. Great. Thank you so much, everyone. We are honored and privileged to be able to share this brief video message from Dr. Soumya Swaminathan, Chief Scientist at WHO. Request Abhijit to play this message.
Hello and greetings from the World Health Organization. Thank you so much for inviting me to say a few words today. First of all, let me say how amazing it is to have an all-woman panel speaking on tuberculosis, but around the Women's Day. And it just goes to show the role that women are playing and have always played, not just in TB control, but also in general healthcare provision. So whether it's, we know that 70% or more of the health workforce is made up of women, and the more peripheral you go, the more you go into primary healthcare, you'll find that the proportion of women keeps on increasing. And ultimately, when you get to the village level, at the point of contact, whether it's ASHA workers or Anganwadi workers or village health nurses, you find that the majority will be women. So I think the first thing I would like to do is really pay tribute to the women who day in and day out do their duties, do their work under sometimes really very challenging situations and without complaining. And in all my travels around India and also in other countries in Africa, I've seen the absolutely critical role of women within the health system, but also in the community. And I know that women health volunteers all over the world have really made a difference in diseases like controlling malaria, reducing child mortality, as well as in TB, obviously. Women also are very much the glue that binds families and communities together. And when I've seen that when the women in a community come together and decide that there needs to be a change, then it happens. It happens. And so this is why it's so important to invest in women, in girls, in their education, in empowerment, in giving them opportunities to flourish and thrive and to contribute to society. And so I want to congratulate REACH for their program, the Sadi Kava Penne program, which has done exactly that. We still have big challenges as far as health is concerned. We're coming out of a pandemic. Hopefully we're coming out of the pandemic in 2022, but the impact of the pandemic is going to be with us for a long time to come. More people have been pushed into poverty. There are going to be more undernourished women and children, and diseases like TB have taken a big hit. Not just TB, but also non-communicable diseases, and particularly mental health. So I hope that going forward, as we're planning for more resilient health systems, investing in workforce, that we also invest in skilling the workforce. We invest in things like building capacity to handle mental health issues at the peripheral level and the community level. This will help individuals cope better, but it will also help them to be able to identify people in the community who may need assistance for depression or anxiety or other psychiatric illnesses, and to be able to refer and make those connections. I believe that we're going to see a huge increase in mental illness, and again we need to take a more holistic approach to health. I know that we are driven by programs quite often, but for the individual concerned and for the healthcare worker who's approaching them, it's one person. And there's no point saying we take care of your TB and we do not worry about your other issues. And that's obviously not going to lead to the best outcomes. So I think both gender responsive, gender inclusive, but also more holistic and comprehensive primary health services with a very well-trained workforce who's constantly also been given some mentoring and some opportunities to improve their own skills is what is needed now going forward. And we can do that now using some of the digital tools and platforms that we know work well, as we've seen in COVID. So I would like to wish everyone, but particularly the women workers who've done so much for healthcare. We continue to work under the most difficult circumstances. तो मैं अपनी महिला बहनों को जो स्वास्थ्य में काम करते हैं, चाहे वो आशा वर्कर्स हों या आंगनवाड़ी वर्कर्स हों या नर्सेज हों, मेरी हार्दिक शुभकामनाएं। ऐसा ना होना चाहिए कि सिर्फ विमेंस डे पे हम लोग ये याद करें, क्योंकि आप लोग दिन भर और महीना भर और साल भर काम करते हैं, और आपके वजह से ही हमारे हेल्थ प्रोग्राम्स और हमारे समाज के हेल्थ में इतना इम्प्रूवमेंट आ पाया। इतने अगर हम वैक्सीनेशन प्रोग्राम सफलता से कर पाए हैं तो ये आप लोगों के बिना नहीं हो पाता। तो मेरी तरफ से मैं आपको बहुत बहुत धन्यवाद कहना चाहती हूँ। हमारे लिए आगे टीबी के लिए और बाकी जो नॉन कम्युनिकेबल डिजीज़ेस हैं उसमें काफ़ी बड़ी चुनौती है, आगे लड़ना पड़ेगा, और साथ मिलके हम लोग लड़ेंगे तो ज़रूर जो महिलाओं का रिजॉल्व है, कमिटमेंट है, पावर है, उससे हम लोग ज़रूर ये मुश्किलों में से निकल पाएंगे। धन्यवाद। थैंक यू वेरी मच।
Thank you very much to Dr. Soumya for taking the time to send us this message. In February last month, in the run-up to this webinar, we announced a photo competition for our Women TB champions. We're very proud to present to you the winners of the Women Ending TB photo competition. Congratulations to all our TB champions, and thank you to everyone who sent in entries. We've now come to the end of what's been a wonderful conversation forefronting women. I'd now like to invite Ms. Sangeeta Patel, Director of the Health Office at USAID India, to offer closing remarks. Sangeeta is a senior US Foreign Service officer who's been working with USAID since 2000. Over to you, Sangeeta.
Thank you so much. And just want to take the moment to recognize and appreciate the humility that I feel right now in the face of so many women and even men across the room as we celebrate and really recognize and honor and commemorate International Women's Day, but also really commemorate the achievement for women ending TB. On behalf of the United States Agency for International Development, USAID, but also on behalf of even our extraordinary partner, REACH, the Central TB Division, the Ministry of Health and Family Welfare, the Government of India, our colleagues from around the world, thank you so much for taking the time to join us and for taking a pause and really reflecting on the incredible journey that we've traveled over the years together. I really feel this sense of great accomplishment, especially when I see these photos and I'm really reminded of the power of women, not only in communities and on the ground, but really serving as TB champions. And inside, I just feel this tremendous warmth because I know that the energy is just palpable. I hear the music, I see the images, I hear the discussions, and I can feel the passion across the room and the commitment to ensuring that this powerful cadre of female community leaders continues. It's not just a project that we're talking about, it's a vision. It's a movement, and really it's something that I want to see hold true even beyond this contest, but really into the future. For us, it's a competition not only to really show the dedication across India of these women, but also, frankly speaking, to the world, to say, hey, here's what dedicated women around the world can do if we're given the chance, if we're given the opportunity. And even if we're not given the opportunity, we'll take it, right? We'll demand it, right? And we'll make sure that in what we do in all of our actions, that we hold true to that commitment. So I know that in today's first section of the webinar, we saw the film, Come On Women, Let's Achieve. And those sentiments across women TB leaders from Tamil Nadu really showed us the different aspects of work, of reality, and really what it takes to work in TB affected communities, the personal, inspirational journeys, the empowerment, and really, frankly speaking, the dedication and the perseverance. It is so enriching to even listen to the panel members for sharing your experiences, for sharing really your own journeys, and all working together to really accelerate efforts to eliminate, to end TB. So yes, gender inequities continue, differences are there, they will continue to play a significant role, not only in just TB, but in all of society, in all of our interactions, and frankly speaking, in how we advance healthcare or even development writ large. Women are constrained only, I think, in my mind, by the limits of their imagination. I think that what we've seen today proves that despite societal norms, despite everything that's happening around us, that there are still ways to prevent and really truly work together to ensure that the barriers of stigma and discrimination and gender and equities are actually resolved. So from my end, a huge thanks especially to Amy, to Blessina, to Prachi, Dr. Camila, Dr. Aisha, Dr. Dasha, Ramya, Sherry, Daneshwari, all of you. This year's International Women's Day theme, hashtag break the bias, It's exactly the call to action for every single one of us. And I say, let us continue not only to support women with symptoms of TB, but yes, also men. And let's ensure that no one is left behind. Trans communities, children, vulnerable. Let's challenge this notion even of vulnerability and ensure that health is not just a priority, it's a right. Everyone should be able to access it. Universal health coverage. Let's make sure that we support all those with TB to challenge society's expectations that they have to remain silent about their TB diagnosis. And let's support all survivors to step up as champions and really show how to challenge this silence and be able to ensure that we're able to break barriers and really that we're able to collectively spread hope and really be able to make a difference. So with this, I stop, I take a pause, I say thank you, dhanyavad, and I know that I look forward to seeing you continue to flourish and continue to shine this light so that others around us, not only across India, but even across the world, can continue in this fight against TB. So happy International Women's Day in advance. And let's continue to have a great evening and let's celebrate how far we've come. Thank you.
Thank you so much, Sangeeta. It was the perfect note to end this on. Thank you, everybody, for joining us today. And take care and stay safe. Goodbye.